Well, hey guys, if you're new here, I'm Dr. Dray. I'm a board-certified dermatologist. Now, if you have noticed that, say, a leg or an arm appears swollen, even lasting overnight, or that your skin has started to feel thick, swollen, heavy, tight, almost like it doesn't even belong to you. Maybe someone's been like, that's just fluid retention, poor circulation. Oh, no. This is the video right here you need to be watching because we're going to be talking about lymphedema, a chronic condition that affects how your body drains lymphatic fluid and how your skin behaves as a result. By the end of the video, you're going to understand what causes lymphedema, how to recognize it early, and what treatments are available that can help protect your skin and keep you comfortable. Lymphedema happens when your lymphatic system, which is a network of vessels that collects and drains excess fluid and proteins from different tissues, when that system is not essentially working properly. Normally, these vessels collect this fluid and they drain it back into the bloodstream. But when these vessels are blocked or damaged or even underdeveloped, fluid ends up building up in your tissues. And this trapped fluid is rich in different proteins that end up inciting a lot of inflammation, as well as skin thickening and eventually fibrosis, meaning the tissues get really firm, really woody, essentially in texture, and lose elasticity. This is not just water weight. It's a complex process that involves both the lymphatic system and skin remodeling. And that's why dermatologists are often the first to recognize it. The skin, it's a window to what is going on internally. The skin changes are visible clues that something deeper is happening. Who is at risk for developing lymphedema? Lymphedema can happen really to anyone, but it falls into two main categories. Primary lymphedema is caused by developmental problems in the lymphatic system. People might be born with it or develop it later on in life. In these cases, it's due to genetic factors. Then there's secondary lymphedema, which is a lot more common. This is caused by either damage or blockage to the lymphatic vessels. This can happen after cancer surgery, radiation therapy, severe infections, trauma, or chronic venous insufficiency, which, as a side note, I recently did a video on chronic venous insufficiency, so check that one out if you missed it. Then obesity is another really strong risk factor because the excess body mass puts a lot of pressure on those lymphatic vessels, which makes drainage a lot less effective. So if you've had cancer treatments, a leg surgery, frequent infections, or any sort of significant swelling after an injury, your lymphatic system, it might just need a little TLC, some attention. What are the warning signs of lymphedema? Lymphedema is not something that typically pops up overnight. It usually develops gradually. And the first sign is typically persistent swelling, usually of a limb, like your arm or your leg. But sometimes you can have lymphedema of the face or of the genital area. Early on, that swelling is sort of soft and doughy. When you press down with your thumb, it leaves behind an indentation. That's known as pitting edema. But over time, the skin becomes thickened. It no longer pits, and the skin can look really shiny. And it takes on what we describe as a peau d'orange appearance, meaning like an orange peel. As the condition progresses, other skin changes can start to appear, like something called hyperkeratosis, which is thick, rough skin. Sometimes you can get these small wart-like growths called papillomatosis. The skin can become very fragile and a lot more prone to recurrent infections, such as a bacterial infection known as cellulitis. You can even get a deeper infection known as a lymphangitis, which will appear as a red streak going up your leg. You might also notice itching, discomfort, and overall heaviness in the legs. These are warning signs that the lymphatic drainage system is not operating properly. How is this diagnosed, and when do we need to get more medical specialists involved? Well, if your doctor suspects that you're dealing with lymphedema, the first step is a good history, meaning asking you questions about the history behind your symptoms, and of course, examining you, looking at you, the patient. They're going to be looking for swelling patterns, and they're going to be comparing both arms, both legs. They're going to be checking for something called stemmer sign. Stemmer sign is when you pinch the skin at the base of your second toe or finger and it can't be lifted. That's a classic sign of lymphedema. Your dermatologist or your healthcare provider, they might order a test called a duplex ultrasound. This helps actually to look at the veins and to make sure you don't have an underlying vein problem, a problem with the valves in your vein that causes blood to not get back up to your heart properly and also can contribute to swelling. They may also order lymphoscintigraphy, which essentially allows them to look at how lymph is flowing around in the lymphatic vessels. The diagnosis of lymphedema, it's mostly clinical, but the imaging can be really helpful in confirming the diagnosis and building a management plan. If there's significant swelling, skin breakdown, or you're getting recurrent infections, that's really when a lymphedema specialist becomes becomes a necessary player on your team. You may even need a whole team of vascular specialists. Dermatologists come in here to help manage the skin complications that result from lymphedema. How do you manage this, and what are some treatments? Well, unfortunately, there's no cure for lymphedema, but it can be managed very effectively. The goals of lymphedema management are to reduce the swelling, prevent complications, and to protect the skin. Starting with just the basics, skincare and hygiene. You want to make sure to keep the skin clean, hydrated, moisturized, basically to prevent cracks in the skin that allow for the introduction of microbes and subsequent infection. You want to avoid harsh soaps, and you want to make sure that you treat minor scrapes, cuts, injuries, and bug bites really quickly. You keep them clean, you keep them covered with a bandage, and you do your best to avoid scratching them, again, by keeping them covered so as to not allow for the introduction of microbes into the compromised skin. Infection prevention is critical here because bacterial infection that leads to something called cellulitis, it actually can end up worsening the lymphatic drainage issues. Then there's compression therapy, medical grade specifically, which I hate saying medical grade because the cosmetic skincare industry has just made that term so confusing. But medical grade compression stockings, which you are fitted for professionally, they're really, really tight. Admittedly, not the most comfortable things to put on, but medical grade compression therapy or even multi-layered tight bandages can help basically just squeeze down on the affected area and help to facilitate the return of that fluid back into the vessels. That's really the cornerstone of management. Then there's manual lymphatic drainage, which I always kind of laugh when I see influencers claiming to do lymphatic drainage for anti-aging benefits, and it's like, dude, if you even knew the real on lymphedema and lymphedema therapy, what are you even waving your hand around there for? I digress. And yeah, check out my video on lymphatic drainage massage if you want more details on that, because I already have a video on that. But when we're talking about medical manual lymphatic drainage for legitimate lymphedema, this is a specialized form of massage and movement therapy that really helps with guiding that fluid back into circulation and really stimulating the flow of lymph. Then, of course, there's elevation. This can be a game changer as well, elevating affected limbs whenever possible. And also avoiding tight-fitting clothing or tight blood pressure cuffs on the affected limb and making sure you are maintaining a healthy weight. Then there's skincare. You can develop an eczema when you have lymphedema, so moisturizing is a key mainstay in managing this type of eczema. You can also develop skin thickening, this warty change over time, which can be managed to a certain extent with topical and intralesional anti-inflammatory treatments like steroids. And of course, we want to be watching for any signs of infection like heat, warmth, spreading redness, pus, and intervening early. But for more advanced cases, there are surgical options, such as lymphovenous bypass or tissue debulking. These interventions can improve drainage, but they're typically reserved for selected patients. The main take-home point here is that early identification, diagnosis, and management, it makes a huge difference in the long-term trajectory of this condition and your overall quality of life. Early intervention can help prevent irreversible damage. Speaking of prevention, let's go over some prevention and self-care tips when it comes to lymphedema. Number one, try and move as often as possible. When we exercise our muscles, they contract, and that plays an active role in getting fluid, blood back up to the heart and away from collecting in dependent areas like your lower legs, your arms when they're down by your side. Avoid prolonged sitting or standing. Set a timer. Every hour, try and get up and move around, stretch a bit. Elevate your limbs at the end of the day. Even short breaks with your limbs elevated, like your legs up or your arm up, can make a huge difference, just in helping to facilitate return back up to the heart. Try and avoid any trauma to the affected area that would further compromise lymphatic vessel integrity. No blood draws in the area. No injections in the area. Avoid tight jewelry there or tightly fitted garments, tight blood pressure cuffs, and maintain good hygiene and skincare. Bathe regularly and moisturize the skin. Daily moisturizing, gentle cleansing, and managing any cuts or bug bites early on to prevent secondary infection is key. And compression therapy when you are at risk. If you've had a lymph node removed, you've had radiation therapy, or previous swelling, make sure you talk to your doctor about preventative compression therapy. Once lymphatic vessels are damaged, they don't easily regenerate. So So early prevention and management are key. All right, I want to end this video with a quick little clinical case example to give you guys some kind of real world idea of how this can play out in real life. So let's take the case of a 55-year-old breast cancer survivor. She developed gradual swelling in her right arm several months after surgery. She noticed that her skin felt tight, heavier, and she started developing small red patches around her wrist. With early referral to a lymphedema therapist, compression therapy, and consistent skincare, her swelling reduced dramatically. The redness resolved, and she had better range of motion in her arm. That's what early recognition can do. So to summarize, lymphedema is a chronic condition where lymph fluid builds up due to problems with the lymphatic vessels. It's basically a failure of proper drainage. Skin changes can be early warning signs, and dermatologists can be instrumental in making the diagnosis early and getting you on the path to the proper treatment and management. Treatment is going to include skincare, compression therapy where necessary, exercising, elevation, and in some cases even surgery. Early consistent management prevents irreversible damaging changes. Not to mention, it improves your overall comfort. All right, guys, so that's what I wanted to talk about in today's video with regards to lymphedema. I know it's something that comes up a fair amount in my comment section, and I've seen people talking about it on social media, and I think there is a lot of confusion about it because somehow it's a topic that gets hijacked in sort of the cosmetic space where it doesn't really belong. I mean, this is a serious condition, and it's not, you know, some day at the spa kind of a thing to pursue. I hope this video was helpful for you. Make sure you drop any questions that you have down below in the comments section, or talk about your experiences with this condition. If you know someone who has this condition, please send this video to them. But on the end slate, I'm going to put my video on a related topic, chronic venous insufficiency. Make sure you check that one out. But if you enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!